Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
62% of the world population has received at least one dose of the COVID-19 vaccine. 10.68 billion doses have been administered globally, and 29.51 million are now administered each day. Only 12.3% of people in low-income countries have received at least one dose. The World Health Organization's chief scientist, Dr. Soumya Swaminathan, says the target is now to boost immunity in a vast population globally if we are to eventually weaken the virus.
So the way vaccines work, and they're an amazing innovation of the 20th century, is by mimicking the organism, the virus or the bacteria. And so the spike protein of the SARS-CoV-2 virus is taken and made into a vaccine. Of course, we know there are different types of vaccines, mRNA, the virus vectored vaccines, inactivated, but they all do the same thing, and that's present in a safe way the antigen of the SARS-CoV-2 to the body. And so the immune response that's generated is very similar to the immune response to a natural infection. But of course, the vaccines are a safer way of stimulating the immune system.
She also explains why we still need vaccination even after recovering from the COVID-19 infection.
So natural infection does stimulate the immune response and gives you some immunity, but it varies from person to person. So if you've had a very mild infection, the immune response may be actually quite low than those who've had a severe infection. And we don't know exactly how long it will last. In some people it lasts a few months, in some people it goes to a year. So the advantage of getting vaccinated, even if you've had prior infection, is that you're really boosting that immune system and ensuring that your immune system will have a good memory to this virus so that it has a very good response if you get exposed in the future, particularly to new variants with new mutations. So hybrid immunity, which is both natural and vaccinated, is the best kind of immunity to have.
The body also has the ability to develop immunity after infection, and this is how.
So our immune system is actually amazing. It's versatile, but it's also complex. And when the body is exposed to a new virus like the SARS-CoV-2 virus, which it's never seen before, the immune system does get activated, and there are many things which start happening. The first and the most rapid response is the production of antibodies. And this is also accompanied by messages that are being sent to other parts of the immune system so that the T cells or the cell-mediated immune response is also activated. And ultimately what happens is that if the body's immune response is strong, it's able to overcome the virus and eliminate the infection, but also it develops a memory response so that the next time the body sees the same virus, it's able to respond much more quickly because the memory cells, both memory B cells and T cells in the body, are able to recognize and respond. So we all talk about antibodies all the time. It's one part of the immune system, but it's a much larger and much more complex system which keeps us healthy and gives us the ability to respond to a lot of infections.
Uganda has since fully opened the economy, thereby removing the stringent measures against the spread of COVID-19. But vaccination is being encouraged, and so far, 16,152,210 doses of the COVID-19 vaccines have been administered. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.